Again, we're in the subacromial space, and one can see that we've got a partial thickness rotator cuff tear here, or even a full thickness rotator cuff tear. One of the things that a common clinical challenges that we see is what to do in the patient whose muscle quality is not terribly good. So this patient may be a Goutallier 2 or a Goutallier 3, where you've already started to have fatty infiltration. We know that there's no mechanical solution to that yet, and as of now, there's really no solution, period. But one thing that many researchers are doing is understanding the role of growth factors in potentially halting or even reversing Goutallier changes in the cuff muscle. So if growth factors are going to be the answer to regeneration of tissues, including muscle, then the key is how do we get them there and how do we have them stay and elute those growth properties. The challenges with many of the available growth factor products is that they're liquid, so as soon as you inject them, they're gone. The other thing is concentration. Bone marrow and adipose tissue, for example, two common sources of MSCs and growth factors, don't have very high concentration, so it takes a high volume. Well, enter amnions. So now you can see the dry amnion streamer loaded correctly in the slot at the 50-yard line. You can see the mark that we had placed on the amnion streamer, the purple, is shown just there at the top, and you can see that I've got it directly loaded in, guaranteeing an equidistance between the two limbs once it gets folded down and captured. Now we're going to hydrate the graft, and you'll see that once it gets hydrated, it becomes quite flimsy to work with. And that's the loaded amnion streamer after it's been wet, and we simply then now need to insert it into the terminal portion of the AmnionXpress. And so I do that by now just taking my thumb, and we slowly and consistently insert it until we get to the second button. You can see the amnion disappear. We can demonstrate this because it's inserted very simply through what is very common and useful to a normal shoulder surgeon. Most of us are very comfortable with the placement of a spinal needle, if you will, or a suture lasso in this case. So now I've advanced it just a little bit beyond the stop, and if I look down the tube of the inserter, you can see the very leading edge of the amnion streamer that we're going to be able to deliver. So this becomes very simple. It's a technique that is incredibly common that we would use with other things in shoulder surgery. So we would simply identify the muscle that we thought was of less quality. In this case, we're going to go to the infraspinatus. The supra's in bad shape up here too, but in this particular case, we're going to go to the infraspinatus and take advantage of this. So we're right in line with this. I'm going to puncture right at the point of the musculotendinous junction here. So now I'm inside the muscle, and I'm going to go parallel with the fibers of that, and I'm able to deliver this down to the depth or the level that is desired. I can figure that out either by tactile feel or by MRI, and now I've been able to insert, but completely in a protected fashion because the amnion streamer remains completely in the confines of the lasso device. Once it's in there now and it's captured, I simply just need to deploy my thumb slider all the way to the end. So you can't see this from in here, but I'm advancing this all the way into the tissue as we go. As I withdraw the AmnionXpress device, my nitinol fork-tipped inserter remains in place. I hold that there. You can see the internal workings of that. And the streamer has been deployed. And now simply once I'm here, I will withdraw the central amnion fork inserter. And now I've completely delivered the amnion streamer